Welcome to the Vibrant Life Radio Show with Dr. Brian Allman.
Let me tell you where we are today. If you happen to be driving around, I want you to come join us at the Reno Town Mall, because that music that you heard at the beginning of the show for KKFT, that's 99.1 FM Talk, our Fox News radio affiliate, is the theme song. That means Vibrant Life Radio Show is right here at the Reno Town Mall each and every week. We invite you to come join us at 1:30. Remember, you can also ask questions if you're listening on 101.3 FM throughout all of northern Nevada, not to mention a couple of radio stations down south who are going to start carrying Vibrant Life Radio Show right here. But you have the opportunity to join the audience. Get on Facebook at nevadamatters.us and click on Facebook, questions for the host of this show, Dr. Brian Allman. And if you have questions throughout the show, remember our number, 775-827-8900. Again, that number is 775-827-8900. Dr. Allman, I've got to share with you, thank you so much for deciding that, yes, indeed, you would do a show to answer people's questions when it comes to everything you cover at your clinic. And Mike Oder in Las Vegas absolutely just emailed us. He's listening right now down in Las Vegas. He said he's located behind Circus Casino, and he wants to know everything that Dr. Brian Allman's clinic does. And is that the right word, a clinic?
Well, sure, it's a clinic, and thank you again, Mr. Floyd, for having us on. And Deborah, nice to see you again. Happy Valentine's Day to everybody out there. I want to shout out to my Valentine, Julene, my beautiful bride of 24, nearly 25 years.
Wow. You married her when she was, what, 5?
She was 5.5 at the time.
5.5.
5.5, yes. Our children are 28 and 23, so that was a bit of a...
Yeah, that's true.
That was a bit of a mystery.
Right, that's right.
Well, we do a lot of things. I'm a general dentist, and I've just been a general dentist on a journey of trying to put, airway, everything from ear, nose, and throat, to allergy, to teeth, to jaw position, orthopedics, chiropractic, physical therapy. We kind of bring all this together. But no, I love what I do. I've really enjoyed dentistry. I've wanted to be a dentist since I was 8 years old. I've been blessed with 26 years plus of practice here in Reno, Nevada. We've just enjoyed Nevada so much and all the people we get to help. So we do everything from extracting a tooth to fixing a jaw to dealing with sleep apnea issues when people cannot wear their CPAP apparatus.
Wow. Okay, doctor, I tell you what, they're flooding in. Remember, listeners, go to nevadamatters.us, leave a question or a comment. Debbie McCarthy will read it on the air, or join the audience right here. Meet Donna Carey. I notice her out in the audience. Meet her right here in the audience at Reno Town Mall, or you can also give us a call, 775-827-8900. Deborah Darr from Carson City says, I am of an age where I notice I'm losing enamel. Does that grow back, and is there anything I can do to stop from losing my enamel?
Well, that's a great question. Once enamel is formed, there's nothing we can do to actually grow it back. We can put it back with porcelain restorations, veneers, things like that. But the most important question really is not how to put it back, but why is it missing in the first place?
Right.
There are a lot of things. A lot of people will grind their teeth. Sleep apneics, for example, will grind their teeth in their sleep. Several reasons why people will grind their teeth, for example, chronic pain or a click and a pop in the joint. And that is something that we are inhibited from doing during the day. During the day, we don't sit around grinding our teeth, unless it is either there's some systemic disease that is causing that, or a drug. A lot of drugs, like you've heard of Prozac and Paxil, the SSRI drugs. One of the big side effects of those SSRI drugs is bruxism. So it will cause, and oftentimes they're prescribed to people. People listening out there, if you've been prescribed Prozac or Paxil, actually it will cause people to grind their teeth in their sleep. So the best way to answer that question is to first diagnose and identify the cause of the tooth loss. Because quite frankly, you can have enamel loss and put veneers on teeth, but if you have not identified the cause of the problem, the root cause of the problem, the root cause of the original or the initiation of the grinding or the enamel loss, the restorations will fail.
Really? So no matter what you put on there, it will fail as well unless you get to the root of the problem.
And let's get to the root of the problem. And that's a lot of what we're about at Vibrant Family Smiles. I'm also the dental director at TMJ Therapy and Sleep Center of Nevada, both on Peckham in the same office. And one thing that I really have focused my education on, my 26 years of practice, is identifying the cause of problem. For example, we will see that tooth loss, that we call it attrition, in kids. And most of the time that has to do with an airway problem. Most of the time it has to do with an airway problem in adults. And that's why your typical night guard, there are a lot of people that are fitted with a night guard that can't wear them.
Right.
And the reason for that is because the reason the night guard is being placed doesn't address the root cause of the problem. For example, sleep apnea. Sleep apneics will clench their teeth and wear their enamel down very quickly, especially the front teeth, not so much the back teeth as the front teeth, because the patient is trying to thrust their jaw forward to open their airway during their sleep.
Right.
But these repeated events fragment the sleep. It really impairs restorative sleep. And so you have a tired patient with worn-out teeth.
Wow. Okay, now, this is perfect because Mike says, could he have the phone number and contact information for your clinic?
Sure, it's 775. We're just a block from your studios here, Mr. Floyd, 775-825-7200.
And you know what, Doctor, I have a personal question as well, because I was so impressed. Number one, for those who might be tuning in to Vibrant Life radio show right here on KKFT 99.1 FM Talk, our Fox News radio affiliate and flagship station. Doctor, I was impressed. I was referred to you by Dr. James Forsyth, the host of Health Matters, also heard on Fox News Radio. But good Lord, the degrees that you have and the licenses that you carry, could you share those with our new listeners as well?
Well, I have 9 fellowships and diplomats, and that's just, years and years of continuing education and getting into orthopedics, anatomy, areas of TMJ problems, orthodontics, things like that. I've always been on a quest to find out or answer the question why. It's like your guest or your question from Las Vegas. You have a question about, well, what causes tooth loss? And, it isn't that simple. It's not just drinking carbonated beverages. It's, there's much more to the answer to that question that meets the eye. So again, it's just 825-7200. Ask for Brenda or Chandra, and they can certainly, and we do a lot of triage over the phone because we can help an awful lot of people, but we don't like people wasting their time or their money.
Right.
So talk to either Brenda or Chandra, and that can really be very helpful.
Well, I'll tell you what, and this is accolades to Chandra, okay, because Shari, my wife, actually called and said to me, she said, boy, that Chandra at the, Dr. Allman's clinic there really knows her stuff. I said, if I'm not mistaken, she should and better know her stuff. I believe she's your daughter, isn't she?
She is my daughter, and she is my stepdaughter, and she's been involved just had an interest in dentistry since she was about 5 years old. She's 27 now, and really has grown up in dentistry. She is very gifted with people. She just has a magnetic personality,
right.
Big blue eyes. And she's somebody, if you have a TMJ problem or you have or you're sleep apneic and you're not wearing your CPAP, give her a call because she's very, very good at ferreting out. Maybe your first step is not in our office. Maybe your first step is with a medical specialist, and we can help with those referrals.
And that free consultation, I'll tell you what, especially during these economic times, Dr. Allman is so well appreciated by everybody here in the audience at Reno Town Mall and those listening on the various radio stations. And speaking of the young lady who paid to compliment to Chandra, she just walked into the studio right now, and that's Shari. Happy Valentine's Day, honey. So remember, listeners, our phone number, 775-827-8900. Doctor, you mentioned the CPAP, okay? For the listeners in the audience and those on the radio station, could you explain that apparatus to them and me?
Sure. Well, CPAP is an acronym, and it stands for Continuous Positive Airway Pressure. And this is probably the gold standard treatment for obstructive sleep apnea. Now, let me back up just a hair. Obstructive sleep apnea most of the time has to do with the jaw and the tongue flopping back into the airway during sleep. It's why anybody out there in the audience with a bed partner, husband or wife, or boyfriend or girlfriend or whatnot, your wife, right?
Yeah.
When, snoring is a sign of big problems. Snoring is not benign anymore. And you'll notice that when your bed partner's on their back sleeping, and they certainly, when they go into slow wave sleep, that tongue flops back into the airway, blocking the airway, sometimes causing just a little vibration, a little noise. But usually, if you have a loud snorer in bed next to you, that you probably have a sleep apnea. Now, what CPAP does, and I don't mean to be too circuitous here with an answer, but what it does is it's pressure. It's room air that's delivered to the nose and the mouth that blows up, kind of just like you're blowing up a balloon,
right,
causing the airway to expand laterally. And the concept is if we can blow up the airway, if we can maintain an airway with air pressure, then you can inhale and exhale through that open airway rather than through a collapsed airway. Because typically what happens is you'll inhale, exhale, and since you're breathing so slowly during sleep, it's right after you exhale, the whole airway can collapse.
Wow. Just totally collapse.
Totally collapse or even partially collapse. And in adults tend to be more prone to the complete collapse, whereas adults are or children are more prone to partial collapse. But both conditions will fragment sleep. So instead of getting good, restorative, deep sleep, long sessions of REM, you're always skirting sleep and awake because it has the effect of you being waterboarded. You're suffocating in your sleep.
Good Lord. I tell you what, Doctor, we're going to do this. We're going to take a short break. We have just enough time for you to give out the contact information for your clinic right now. And I'm going to also share with you when you did that impersonation of someone with sleep apnea, my wife thought that I had done it because she's heard it so many times at night. And that's a true story. How do people get a hold of you?
You can give us a call, Dr. Brian Allman at the TMJ Therapy and Sleep Center of Nevada. Also, Vibrant Family Smiles at 825-7200.
This is Vibrant Life Radio Show on Fox News Radio as well as 101.3 FM. We will be right back.
Hey guys, I want to tell you about Capriotti's Sandwich Shop. My favorite sandwich is the Bobby. It's homemade butterball turkey, cranberry sauce, and a hearty stuffing, all in a fresh baked roll. I like mine with a chopped Italian salad and a large iced tea. Now that's a lunch I can get behind. Capriotti's Sandwich Shop is located at 5140 Kitsky Lane, across from Lowe's Home Improvement Center. Stop by and pick up a party platter on the way to your next Wolfpack tailgate party. Call ahead to place your order at 336-4906 to order your game day sandwiches, or check them out on the web at capriottis.com for awesome specials. Capriotti's also delivers. That number again is 336-4906. Hey, I don't know how freaky fast they are, but the sandwiches are definitely worth it. Check out Capriotti's today at capriottis.com or give them a call at 336-4906. Capriotti's Sandwich Shop. Extraordinary food for those unwilling to settle.
Let me tell you about Larry Bigler, CPA. You know, there's a lot of accountants and bookkeepers as well as CPAs located right here in the great state of Nevada as well as our nation. But believe me, there is only one Larry Bigler, CPA, and you can get to him by going to LarryBigler.com. That's LarryBigler.com, or give him a call. That phone number is area code 775-323-8131. Now, let me tell you why, and I'll give that number out again, but I'm telling you to get a hold of Larry Bigler because it doesn't matter what your financial needs are. It might be creating a new business, an entity, or taking care of one of the infamous nastygrams you've received from the IRS. That's why you get a hold of LarryBigler.com. Give him a call in Reno, Nevada at 775-323-8131.
Ever wondered if all dry dog foods are the same? At Bill Jack, we're different, and it's all in how we make it. We use quality ingredients like the 25 pounds of fresh chicken used to make every 30-pound bag of Bill Jack Dry Adult Select. Slow cooked in small batches to help preserve key nutrients and deliver great taste for even the finickiest of dogs. Maybe that's why we've been around for over 65 years. Feed Bill Jack and see what extraordinary nutrition could do for your dog.
All right, we are back now with the second segment of Vibrant Life Radio Show with Dr. Brian Allman. During this break, I can't believe this, someone from the audience who, quite frankly, never listens to my talk shows has just joined the audience and said, I came over here to listen to Vibrant Life Talk Show because she was impressed, and I really mean that, Doctor. She was impressed last weekend with your talk show, listened to every single solitary word. Listeners here in the audience and on our radio stations, I'm going to now introduce you to my wife, Shari Floyd. Shari, you had a question for the doctor.
Well, I was very interested in the show because about every other night, I wake up in the middle of the night and Eddie is on his back choking. And so I have to poke him and wake him up and tell him to turn on his side. And so I'm really worried about him.
Well, I would advise that you stop putting that pillow over his head. That would be my best advice for you, Shari. No, this is actually very, very dangerous. Now, if I can share, permission
Please,
to share. Okay.
absolutely.
Eddie, you're, how old are you?
65 years old.
Very young, 65-year-old. But 65-year-old men, very high prevalence of stroke, sudden death, atrial fibrillation. Sleep apnea has also been linked to kidney failure.
Wow.
Diabetes, any hormonal dysregulation issue you can think of.
Didn't you lose your mother to sleep apnea?
I actually did. I grew up watching my mother die very slowly from undiagnosed, unidentified sleep apnea.
Wow.
And so it's a subject that, we can cure this in children. If we take a look at kids and they need their tonsils and their adenoids out, boy, that has got to be done. We've got to preserve airway as early in a child's life as we can. And that will prevent narrow jaws and crooked teeth. So in children, we can often cure this disease. But in adults, we manage it. It's a lot like diabetes, and it's a lot like other chronic problems that we have to manage over time. But there comes a point when the heart races, like he'll stop breathing for periods of time, several times, even dozens or dozens up to 120, 130 times per hour.
Whoa.
He'll stop breathing. And what happens is, what do you think happens to his blood oxygen? It goes down. So then the kidneys get involved. Kidneys really need oxygen. They're very sensitive to oxygen. And without going into the physiology, the kidneys will then drive the heart to beat faster because the kidneys are saying, hey, heart, you know what? You're being kind of lazy because I'm not getting enough oxygen.
Right.
So start beating. So your heart will race and calm and race and calm and race and calm. To you, you hear the noise. The disrupted sleep, the torn up bed sheets. In children, it's the bedwetting, it's the ADD, it's ADHD oftentimes. It's just all of these things that culminate eventually into the plumbing breaking down. Stroke, heart attack, things like that. And so the medical literature is very clear. This isn't my opinion. Every medical specialty is affected by poor sleep, non-restorative sleep. So your husband, and how long have you been sleeping together?
15 years.
15 years. You have watched him over time get worse. 15 years ago, maybe not so bad. But over time, and maybe you've put a little bit of weight on over the 15 years. I imagine, that's what happens when we're...
I've noticed it's worse as he's gotten heavier.
Right. And other things, weight will influence also. And the reason why weight influences, we think it's because you deposit fat in your neck or your chest. And actually, what's crazy is that we actually deposit fat in our tongues. And so as we gain weight, we can increase the volume of our tongue with fat by up to 37%. So when they say, hey, fat head, no, maybe it's fat tongue.
Especially for a radio talk show host. Think about it. You would think I'd get enough exercise.
But in children, this can be devastating. In children, this can be devastating because we can set a kid up for a lifetime of medication. We can set up a kid for a lifetime of poor performance, labeling, misdiagnosis, mistreatment. As adults, if you were talking about economics and healthcare dollars and things like that, on average, the untreated sleep apneic will utilize 10 times the healthcare dollars that a non-apneic will.
Whoa.
And the very interesting thing about it is I know that maybe you're interested in teeth or gums or things like that. And we'll get to those subjects in subsequent weeks. But this is one of the most important things dentists can do is identify sufferers. So with you, Mr. Floyd, you need a sleep study. You need to go to, say, Pulmonary Medical Associates, see some of my colleagues like Dr. Christina Zod or Dr. Michael Jackson, Dale Santos. I mean, there's so many great sleep specialists over there. And you need a sleep study. You need to go in, have your oxygen measured while you're sleeping, heart rate. It's the most comprehensive test in medicine is a polysomnogram, a PSG.
Really? I
Yes.
did not know that.
Absolutely. It's one of the most important things I can refer my patients for if I suspect they have this problem.
Is this very expensive?
The testing?
Yes.
Well, most insurance covers it. It's a medical problem. Most insurances will cover this completely. Now, I am not, and this is one thing, ladies and gentlemen, as we course through all these different topics that we're going to get to, I am not an insurance expert. I have insurance experts in my office when it comes to, like Chandra, for example.
Right, exactly.
But in medicine, I would call Pulmonary Medical Associates, and I would have, just talk about it. Let them know that, well, if you come into our office, I can make a referral over, suspected obstructive sleep apnea, and then send you over there for testing.
Right.
And then that brings us back to, well, how do you treat this problem? Well, the very cool thing about this disease, unlike other diseases, is if you manage and you treat your sleep apnea adequately, you will bring your morbidity and mortality. This is your chances of dying or having, ill health.
Right.
For lack of further definition, but you will bring your morbidity and mortality back to baseline, back to near normal.
Whoa.
Morbidity and mortality.
That is phenomenal.
Oh, it's incredible. And so it's something, sleep medicine is the newest specialty in medicine, and it is the fastest growing because it's a lot like, say, AIDS was in the 70s.
Right.
We had a couple cases, oh my goodness, and then all of a sudden we had 1,300 cases, and then all of a sudden we had 30,000 cases. It wasn't that it was spreading that quickly, it's just that now we can more easily identify.
Right.
And refer and diagnose and treat properly.
And doctor, you mentioned your mother. I mean, let's face it, your mother was probably raised at a time when nobody even knew. I mean, including your own father probably had no clue that noise she was making at night was a medical problem and not just, quote, a snoring issue.
Yeah, and let's just talk about today. Let's just talk about the state of identifying this disease today. In dental school, we got zero training on identifying this problem. That's why I teach courses once or twice a month. I'm all over the country teaching courses in dental sleep medicine to my profession.
Right. In other words, that's exactly why Dr. Forsythe asked me to interview you in the first place. He said, when it comes to what you do, there is no finer or better expert in our country right now. That Dr. Forsythe, who's the host of Health Matters, has his very own oncology clinic here in northern Nevada. I mean, he paid you accolades up and down when it comes to what you do.
Well, let me tell you a little story about Dr. James Forsythe. He is a pioneer. And years ago when I first came to Reno, one of my mentors was a dentist, Dr. Harry Massoth, who's long passed, and he was a great influence on me. He actually started doing dentistry in some of the local nursing homes. And when I first came to Reno, he knew I had an interest in geriatrics. And Dr. Massoth said, hey, could you see some of my patients over at Physicians Hospital, which is over off of Audie in Sparks? And I said, sure. Well, over the course of a couple of years, with Dr. Massoth's guidance, we started a dental health program in every nursing home in the state of Nevada.
Wow.
From Boulder City to Reno, Carson, Dayton, Las Vegas, Henderson. And the reason I bring this up is one of the first docs I met at the time was Dr. James Forsythe. He was doing the same thing in medicine as I was doing in dentistry. So I have always had a very high regard, high respect for Dr. Forsythe, and I haven't seen Jim for a year or two, but I really appreciate his kind words.
Well, I tell you what, if you and your beautiful wife are out and about tomorrow, he actually comes and does Health Matters right here at Reno Town Mall. I've shared with the listeners and the audience that we do Vibrant Life radio show right here every Thursday at 1:30, but every Friday, if you want to come and see Dr. James Forsythe, that is 9 a.m. every Friday right here in the Reno Town Mall. And you lecture not just to the public, you lecture your fellow, if you will, dentists and doctors.
I do, and it's very exciting. We can make teeth look pretty. We can pull that painful tooth. We can do a root canal on that abscess tooth, and we can mitigate a lot of pain and infection. But when dentistry now has been asked by medicine, the American Academy of Sleep Medicine said, "Hey, dentists, we need you to make appliances to help us with our patients that can't wear their CPAPs." That was initiated in 1995 and republished by the sleep specialists, the physicians, in 2006, February 2006. And where's my profession? My profession has really been slow to respond. And one of the most important things we can do is identify our sleep apneic sufferers and then co-manage with our airway surgeons, our ENTs, or our pulmonologists, sleep specialists, in order to help manage this disease.
You know, Doctor, I've got to share with you before we close out today's show and give out that contact information for you and your clinic. I've got to share with you that we only had one, but it came from several people. One complaint about your inaugural show here with Vibrant Life, the radio show, and that was, it's too short. That was started with my wife, and I heard it from 4 other emails that said, I would like him to consider going a little longer. During the month of March, sir, we would like you, especially with all of the talent that you can bring in the way of special guests, doctors who you refer people to, and also some of the questions that will come from the audience and our listeners. We'd like you to consider taking Vibrant Life to a 1-hour talk show.
I'd actually like to do that because I'm looking at the time, and we're out of time, and I was just getting warmed up. I think, and what we'd like to do with Vibrant Life radio show is to make it more than just medicine and dentistry. We would like to take it maybe to the restaurants, how to eat better, how to live better, how to enjoy life more, that vibrant life that we're all looking for. And so if you wouldn't mind, I'd love to bring in some of my colleagues that do they're all about vibrant life.
You better believe it. Let's tell the listeners again, one last time, how they get a hold of you and your clinic.
Well, you can call us at the Vibrant Family Smiles and TMJ Therapy and Sleep Center of Nevada at 825-7200. And thank you so much, Mr. Floyd.
Vibrant Life radio show in front of a live audience every week, 1:30 p.m. on Thursdays. Come join Dr. Brian Allman. We'll see you next week.